Hi, I'm Gary Bebow, CEO of White River Health System, and this is a June 2015 CEO Connection. I'm really proud today to have as my guest Dr. Krishna, who is a neurologist and has been on our staff since August of 2014. Dr. Krishna practices with Dr. Gonzalez on Harrison Street at the Bateswood Neurology Clinic. And so in the event that you need his services or have questions to ask him, you can contact him at that location. So, Dr. Krishna, you've been with us since August, and tell me a little bit about how your practice has been going since you've joined us.
Well, thanks a lot for the introduction, and our practice has been going great so far. So we're pretty much located at Bateswood Neurology Clinic across the hospital on the Harrison Street. And well, like my partner is Dr. Gonzalez. So we both see general neurology patients, pretty much Parkinson's patients, dementia, headache, multiple sclerosis. Well, I have a little bit subspecialty interest in epilepsy and neuromuscular cases, and Dr. Gonzalez sees sleep patients too, and she also has a sleep lab just beside our clinic. And so far, everything has been going great. And today is one of the days, like we are starting Botox actually, from today afternoon for migraine patients. So I'm very much excited about that. So.
I'll tell you, we're so proud to have both you and Dr. Gonzalez with us. Neurology is really needed in this part of the state, and I know that both of your practices have really grown quickly. In fact, probably there's some times when it's difficult to get patients in on a timely basis.
Yeah, I'm pleased to hear that, and we encountered those situations, like, trying to squeeze in patients early, and our slots are like completely booked for the next 2 months.
Wow.
Yeah.
Well, we're really proud to have you here. One of the things that you've been working with us on is having an epilepsy monitoring unit here at the facility. Tell me a little bit about that, and what can we expect in that implementation?
Sure. Thanks a lot for the hospital giving me the tool of epilepsy monitoring unit. I did that as a part of my fellowship training at Wayne State University, Detroit. So basically, epilepsy monitoring unit has video EEG. Video EEG has like a video and an EEG. So EEG is like a test where you put leads on the brain and check for brain activity, and if you see any activity concerning for seizures. So with the help of the video, you actually, so what we do is we admit the patients in the hospital, and especially the ones who has like spells concerning for seizures or like already having seizures. So we admit them on a Monday morning and do a continuous EEG monitoring for next 2 or 3 days and capture these spells and see if these spells have any EEG correlation concerning for epilepsy. That's one of the major gold standard technique to know if the patient really has seizures or not. The other uses of epilepsy monitoring unit is when you're, as a part of epilepsy, you also do surgeries. And when you do surgeries, you need to definitely localize like where the spells are coming from, and that's another use of this test, in epilepsy monitoring.
Well, when do you think we'll get started in providing that?
So far, like I've heard, like mostly it's going to be from July 2nd week.
Okay,
so not so far.
not so long from right now. So, there's not many of them in the state, is there? I mean, where else can a person in the state get that electronic or epilepsy monitoring unit?
So the other two places which we do video EEG and epilepsy monitoring unit is like one is at UAMS, and the other thing is St. Vincent's Hospital in Little Rock, and I think ours is third. So whole state of Arkansas.
Well, I'll bet we'll be really busy. It's because we have specialists like you on the staff that makes that possible, that we can serve this area. And I'm so really proud to have you here with us. So thanks for coming in and talking to me today. And the standard of the month for June is ownership. Ownership is so important that for all of us. I really look to have the staff at White River Health System looking for new ways that we can do things better. Whether it's reducing our costs or improving our quality or improving our efficiency, it takes all of us to take ownership in our facility for us to be successful. So during this month of June, I want you to take particular attention in how do we provide this organization, or how do we make this organization better. We can manage up each other. We can talk about all the great things we do at the hospital, because No one is more important to our quality and how people think about us than you as our staff. So during this month of June, let's pay particular attention to taking ownership in our success. I'm pleased to report that Cindy Smith is the Employee of the Month for Stone County Medical Center. Cindy's been with us for about 5 years, and she really has done a great job. She's done some work in White River Medical Center in utilization review, and we really respect Cindy and the great work she performs for us. So congratulations to Cindy for this recognition. The Employee of the Month for White River Medical Center for the standard of behavior, commitment to coworker, is Sarah Gilbert. Sarah has been in respiratory therapy and has been employed at White River Medical Center since 2004. Based upon all the feedback we got regarding Sarah, boy, she's really well deserved of that recognition, and so congratulations. Recently, we've added 2 leadership positions for White River Health System. First, we have Phil Hacker has joined us as our Chief Financial Officer. Phil has got more than 20 years of experience in the area of hospital finance, and I know he'll do a great job for us. Phil's from Texas, and I know everybody's really looking forward to having them join us in White River Medical Center. The other addition is Jeff Rivestek, who's our Chief Information Officer. Jeff is from Northern Illinois, started in mid-May, and I know everyone is expecting great things out of Jeff, and he comes with great experience, and I know that both he and Phil will have a major impact on our success in the future. So please join me in welcoming them to the staff. On June 9th, our community education event is chronic pain, and Dr. Miraj Siddiqui will be providing that program that day. Please come to the Women's Center Conference Room June 9th at noon, have lunch with us, and hear Dr. Siddiqui talk about chronic pain, and I know that that time will be well spent in hearing what Dr. Siddiqui has to say. Each year, the White River Health System Foundation hosts this White River Health System Golf Classic. This year, it's on June 20th at Eagle Mountain Country Club, and volunteers are needed. If you're available on that date, I hope you'll come out and help make this event the best one ever. Every 6 months, I conduct an employee forum at White River Medical Center, wherein I bring the staff up to date on some of the important things happening here at the hospital, including how we're doing on some of our metrics or our pillars. At the end of each employee forum, we ask that the employees give us feedback, and if you'll get on our Survey Monkey and provide us that feedback, I'll be sure to use that in the future to make those employee forums even more meaningful to you. So take a few minutes and fill out the survey form on Survey Monkey. Every 6 months, White River Health System has a Leadership Development Institute where managers are given training on how we can do better in leading our organization. We had our Leadership Development Institute on May 27th and 28th, and I'm expecting our leaders who participated in the LDI to come back, communicate with you the things that we learned. As a result, I'm expecting that our organization will perform better, and it will be a better for a place for each of our staff members to work. National Hospital Week was celebrated during the week of May 11th. During that week, we had special events at White River Medical Center, Stone County Medical Center, and at the different locations within the White River Health System. I hope each of you participated in the National Hospital Week celebrations, and you received your gift, and I hope that we all properly acknowledged you for your contributions and effort towards making our organization a great one. So thanks so much for the hard work you've done. This concludes my CEO Connection for June, and as in the past, if you have suggestions on how we can make this better, please be sure to let us know. Thank you.